So, for those of you who don't know me, I am Hande Küçük McGinty, and like I said earlier today, I really wanted us to think a little bit about the future. And Kai, I think, did a really good intro about the future and what are the interests in the different communities for going forward. Like we said, we talked a lot about the great tools that we built, and but I really want to give a little bit of background about myself. I'm a computer scientist by training, but I worked with interdisciplinary teams for about 2 decades now. And I find this fascinating. I think it's great that we can synergize different domains and find out connections and really express them in ways that we can communicate with the machine. And my PhD is from University of Miami, where I worked with Stefan on building bioassay ontology and direct target ontology. As I was continuing on my PhD, I also joined Collaborative Drug Discovery, CDD, and I worked on a bioharmony annotator there. And bioharmony annotator uses a lot of great ontologies, including bioassay ontology and direct target ontology, for annotating bioassays and machine learning in the back end too. So uh, I am involved with other ontology groups, like the OBI ontology group, and now food ontologies, food on. When I made the transition from the biomedical ontologies to Ohio University and started working with the USDA for building an ontology for their food data central tools, I found myself in the middle of food and agriculture ontology realm. And That kind of got me thinking about how everything is connected and how it is all connected when I was transitioning from the biomedical ontologies realm to the food ontologies, agricultural ontologies realm. I realized that, one of the many things they have in common is how they affect health. And not only human health, but animal health and even environmental health. So that's how I found all the buzzwords that I can find related to, holistic healthcare, and decided that I think it's a good time for us to have a little bit of discussion all together. I hope that everybody feels free to jump in and ask questions and unmute themselves and show themselves and, bring on the cocktails and the coffees and teas. This is the time that I really want to use for breaking out and really discussing all of this. Um, and today I have also Damien with me, but I first of all I kind of want to give a little bit of where I found some of these definitions and some of these terms. So when the NIH talks about whole person research, and they're talking about how it's different from reduction based research, which mostly focuses on single interventions and their impact on one or a couple of different systems or processes. But rather they're interested in how interconnected the systems are and how they interact with each other. And that to me said, well, there's need for building concordant ontologies that can evolve easily and fast. And I think that's been kind of the theme coming along today, which is really great. And because I really want to hear everyone's thoughts about this. And, there's so many different words and there's so many different terms that we heard in the past couple of days. There were the pathways, the genes, the drugs, the diseases, the phenotypes, and there are more. There's climate change, there's poor diet, and there's social and psychological effects, and how it's affecting on health and how this is affecting everything around us. So I really want to introduce Damien. Damien is the ontology development lead of the Public Health and Bioinformatics group, which is a 20-person group at the Faculty of Health Sciences at Simon Fraser University in Canada. Since 2013, he has been developing biomedical ontologies to support rapid pathogen whole genome sequencing and analysis. Damien founded the Food Ontology and the Joint Food Ontology Working Group to facilitate foodborne disease, agriculture, nutrition, and food science data sharing. Foodon adapted Languel. It's a popular food composition thesaurus, and it's now being used to support a wide variety of research and interagency data sharing projects. Damien and I met on the Ontology for Biomedical Investigations curation group, and he's also participating in the operational side of OBO Foundry Ontology Consortium.